It's April, so it's PMDD Awareness Month. PMDD stands for premenstrual dysphoric disorder and is a hormone-based mood disorder that is linked to your menstrual cycle. I was diagnosed with PMDD when I was about, I want to say 21? Early 20s. However, I have had PMDD pretty much since puberty. It wasn't as bad in the beginning, but it got significantly worse as I got older. What happens when you have PMDD is that your brain has a bad reaction to the hormone changes that your body makes during the luteal phase. I don't know how to say the word. This phase, which is the phase after ovulation, but before your period. This phase usually lasts about 2 weeks and is where PMDD symptoms occur. Symptoms you might experience include severe mood swings, anxiety, depression, rage, feelings of hopelessness, losing interest in things you usually enjoy, and the biggest symptom of all is having thoughts about offing yourself. PMDD is often confused as PMS, but it is actually much more intense than PMS. PMDD makes you want to harm yourself. PMS does not. PMDD also gets confused with bipolar disorder. But unlike bipolar disorder, PMDD specifically lines up with your menstrual cycle, and your symptoms will line up with your cycle. Now, the first step you would take to figuring out if you have PMDD, if you think you have it, would be to track your symptoms for a couple months. If you notice a consistent pattern of symptoms appearing right before your period that go away as soon as your period starts or soon after your period starts, you might have PMDD. So after you've tracked your symptom for about 2 to 3 months, then the next step would be to take your symptom trackings to a doctor to get an actual diagnosis. There is no blood test or any other test that will show that you have PMDD. It is diagnosed based off of your symptoms. Now, unfortunately, PMDD isn't well known, so your doctor might not know how to treat it and might not even know what it is. If your primary care doctor is unsure about it, you can always bring it up with either a gynecologist or a psychiatrist. PMDD is listed in the DSM-5, which is basically a handbook that psychiatrists use that lists and provide details on mental and brain related conditions. My therapist had actually never even heard of PMDD until she met me, but she was able to find it in the DSM-5. Now, there is no cure for PMDD, but there are treatment options. The first line of defense is usually birth control and SSRIs, which is antidepressants. If that doesn't work, next would be chemical menopause, which is a shot that basically puts your body into menopause. This option can be very expensive though if your insurance doesn't cover it. I tried to get it. It was $4,000. There was no way. So I never did the chemical menopause. Lastly, if all other treatment options have failed you, there is surgical menopause in which you get your ovaries removed. This, however, can be very hard to get because most doctors will avoid removing ovaries as much as possible. I myself ended up having a hysterectomy, but I could only get 1 ovary removed because I could not find a doctor to take both. And while my hysterectomy and having 1 ovary taken out has helped significantly, I do sometimes still feel like super anxious or super sad like once a month, although it is not nearly as intense as it was before my surgery. But for PMDD, you want both ovaries removed. That will instantly put you into menopause, and after that you will be on hormone replacement therapy. So those are the basic things you need to know about PMDD. If you would like to learn more, please go to iapmd.org.